Tell us about the different models you have now, because you started it with this gigantic, just one singular model that and now you have these the mouse. What are the different models you have now?
Sure. Right now, we like, as far as your listeners go, I would think the Brain Gauge Home, the Brain Gauge Pro, and the Brain Gauge MD are the three that they would be most interested in. We have some research models as well, but that's sort of those are usually custom made. All three look alike. The Brain Gauge Home is for the home user. That's, it allows like a family, everyone in the family to test, up to 5 users, but we usually modify that if you got a big family. Brain Gauge Pro is, most clinicians use that. Most professionals use the Brain Gauge Pro, and that allows for an unlimited number of users to test. And then the Brain Gauge MD is our FDA listed model. And that's typically used where whoever's using it is in an institution that requires an FDA listing. And really the difference in cost has really got to do with bureaucracy. Mm. We'll leave it at that.
I understand. I get it. I'm in medicine. I know what bureaucracy is.
Yeah, but it's really the paperwork that is the price difference between the Brain Gauge MD and the Brain Gauge Pro. Brain Gauge Pro is better suited for research as well, because you can modify the different programs. We can change the protocols. On the MD, everything's set. I mean, we don't change anything. So those are the main differences. We also, with the MD, we can give you normative levels. And so we can say, we can use the normative values and tell you what we would consider would be within the norm.
Do you see this technology being used now or in the future for, neurological diseases? That's something that's, of course, expanding more and more people are dealing with neurological issues. Do you see the brain gauge as a metric, something being used in doctors' offices, hospitals in the future?
It is right now. I mean, it's being used worldwide in different doctors' offices, different researchers. As far as which demographics it's been used on, we've both in the clinic and in research studies, it's been used with developmental disorders such as autism, ADHD, OCD, ADHD, I meant, with degenerative disorders such as Parkinson's, aging dementias, Alzheimer's, and basically with that, we see people who are trying to slow the progression of degenerative disorders and saying what works and what helps. Sometimes just brain training, brain exercises will help. We also, with pain, chronic pain, you can look at, there are different things that the brain gauge can be used for evaluating. It's got a pretty big footprint in terms of TBI, especially in some of the studies that we've done. We've done quite a few studies with TBI, but a lot of clinicians are using it to track recovery, depending on, and it really doesn't matter what kind of trauma or what kind of treatment that they're being used for any particular trauma, whether it's TBI or PTSD, whatever kind of trauma, whether it's emotional or severe or physical or both. But it's been used quite a bit and for a lot of different treatments, and especially is helpful to clinicians when they do multiple treatments and they just want to see which treatment is more effective. And sometimes one treatment will work at first, but then it starts losing efficacy and it's time to change, or maybe it's time to roll off. And that's how they basically track people very well. So it's been set up so that you can glance at their scores and see if they're improving fairly rapidly. Graphically, you can look at somebody's history very, very easily. I think I hit all the different groups. But basically it's agnostic. The brain gauge is agnostic, doesn't care what kind of neurological disorder or neurological insult there is. If you have an insult, it will show up. Like I said, even sleep deprivation, clearly shows significant changes. And we do have multiple measures. And so that gets a little more complicated when you look at what we do is we give one comprehensive score that's generated from all those measures, but which are different mechanisms, but you need all those mechanisms intact to give you a full 100% score. But different problems or different insults will create deficits in different places or in different areas or mechanisms. So
makes sense.